Special thanks, Anugabaji, for joining RISO platform. You are working as a professor in Amity University, Gurgaon, Department of Public Health and Nursing. It's such a wonderful possibility for our platform to have people like you with professional skills and dexterity and different perspectives and insights to comment on very much important topics which are actually a necessity in today's context to be talked over and discussed. Once again, a very warm welcome, ma'am, to you at the platform of RISO. And I would just like to start because we're going to be covering total number of questions, fine. So my first question to you is provide your comments on the research on the outreach activities. Provide your comments on the outreach activities, programs, and challenges faced by the Indian government in the public health sector.
First of all, thank you so much. Thank you so much. It's a privilege for me to be a part of this session. Thank you. I'm very thankful to Dr. Surendraji for giving this opportunity. And today I'm going to share my views related to the public health, activities, or we can say that what exactly happening in the public health sector. As I'm working in this field, in this public health field from last 19 years, so I think the government, even the public health experts, they are facing a lot of challenges while doing outreach activities. Now, first of all, what is actually outreach activities? When we talk about the outreach activities means like the activities which we usually plan for the public so that they can aware like what are the services provided by the government for them, basically. But when we actually get into it, when we actually enroll ourselves in the outreach activities, we feel that the government faces a lot of challenges, starting from lack of trust. Like the people who are living in the community in that particular area, basically, they don't have trust on the government employees. They always think that like they are just passing their time, the services provided by them, they are not up to the mark, and they are just using the resources of government like that only. Another thing I have observed that like government employees, they the major challenge they actually face, that is lack of resources in the public health sector. See, we are in 2024, but still the resources are not available. We can say that it's not up to the mark in all the healthcare sectors, in all the health centers which are available in the public sector. Uh, we don't have skilled workers also, we don't have proper resources also. So lack of resources, lack of skilled persons, because of that we are not able to provide the actual services to the public. We are not justifying the needs of the public, we are not justifying the needs of the community. This is the basic challenge which are facing by the the employees who are working in the government sector for the public health. Another thing which I have observed, that like they only communicated me this thing, that people who are living in those areas, they are spreading wrong information regarding the organization. I would like to share one example with you here. Like I will not take the name of the this the area and all, or health center. We usually visit a center near to our university only. 2 3 centers we usually visit, and we have observed that like there is one center now, that sub center is upgraded to primary health centers, and the doctor who is available in the center, he is very active, and he's a very good observer. He planned the things that very nicely. He's very active in doing everything in the center, but the people, they are spreading wrong information about him or the employees who are working here. Like he is not present in the center, there is no sense of going in the center, the services provided by them, they are not up to the mark, they are giving wrong medications to us. So I can understand, yes, the government, they took a lot of initiative for the public, for the community who are residing in the areas, but still the people who are actually working in the health sector, who are actually working in that center, they are facing a lot of challenges to meeting those needs. So this is my observation.
Again, thanks a lot, Anugabaji, giving your insights on the very important question outreach activities, programs, and challenges faced by Indian government in public health sector. We've
Yes.
seen lack of trust factor is one reason, and then dexterity, professional skills, and resources, and also miscommunication. At times, government employees or personals there with skills, medical doctors, public health experts, but there is since kind of a rumor thing, wrong communications. It may be antithetical, anti-government things. We don't know exactly, but there are a lot of multiple factors
Yes.
which
Yes.
actually
Yes.
turn out to be major and massive challenges in the area of public health, specifically for government, ruling government. So it becomes very difficult, not exactly for government, but for the community as well. Thanks a lot for your wonderful and deep insight perceptions. They're really helpful for our audience, I'm sure. So would like to move on to my second question, which is again an important question, ma'am. It says, what in your professional opinion, what in your professional opinion are the serious and real challenges in the public health sector?
See, when we worked in the public health sector, we as a public health experts, we also faces lot of issues. Lot of issues. Now, starting from, we can say that like whenever we are going to plan an activity, whenever we are going to do some activity in the public health sector, it might be some outreach or social activity, we can say that you need collaboration from various organizations. You can't see whenever you plan any activity, you have some objectives in your mind, you have some aims in your mind, like I want to achieve this thing, I want to achieve this thing, but you are not able to achieve all your objective until unless the community participation is there, until unless the organization, the health sector collaborate with you in that particular program. So you're not going to achieve any objective in that case. For example, I would like to share one example with you here. Like as I have already told you, we usually visit many areas near to our university only. So in one of our area is there, that is they have community health center, and that health center, they have all the services available there. They have resource, they have very good resources over there. They, everything is up to the mark in that particular center. But when my team usually go and visit to that area, the medical officers who are in that center, they are not ready to accept our services, they are not ready to accept our behavior, they don't want to do any activity in collaboration with us. So this is the biggest challenge when we are going to plan any outreach activity in those areas. Second thing, see, you, what exactly public health experts do, they usually did all these activities, they usually plan their things, they usually plan the activities only for the society, only and only for the people who are living in that particular area. But if you are not getting any support from the community, then what else you will do? Like the community participation should be there whenever you are going to plan anything in your area, when you're going to do anything in that particular area. So this is the biggest challenge. The community people, the volunteers, they the people, they are not coming out from the society. We need some volunteers to achieve the objectives. So the volunteers, the strength of volunteers is too less. Now, another thing is the main problem the public health experts faces, even I have faced during my graduation, during my post-graduation, during my data collection in the doctoral period also. People, community people, most of the areas, they don't want to open the doors. They will see you, oh my God, फिर से आ गई. They will shut down the doors. They don't want it, you, like they don't want to face, they don't want to show their faces to you. They don't want to talk to you. They are not approachable also sometimes. So they are extrovert actually. So this is the biggest challenge we actually faces. For example, like last month I have conducted one research on the violence against women in community area. So when I usually visit the houses for collecting the data, my questions are not actually directly, because when you're going to ask direct questions to the community, they will never answer to you. They will hesitate to give answer to you. So I thought I will not ask direct questions to them. So I have modified my questions somehow, and I asked 10 questions to each and every woman who is a part of that community. Around 20 families were there. None of the person is ready to give answer to you. None of the person. They never open the doors for you. Only I think hardly 2-3 families they open the doors for me, and females come up from the houses and they talk to me and they share their views related to that particular topic. But rest of the families, they didn't open the door. They don't want to share their insight on that. They don't want to share their opinions on that. So it's very difficult whenever you go to those societies, those communities where people don't want to open the doors, they will shut down the doors. Like, now अब क्या करने आ गई है, रोज आ जाती है, रोज एक ही चीज पूछती है. So it's very difficult for the public health experts to tackle with all these things. Second thing, which is very important. See, we talk about we can say that the death rate in the community, we talk about the birth rate in the community, but how you're going to collect the data? Until unless you go and interact with the public, until unless you go and visit the houses one by one, you can't able to collect the data related to that, right? So it is very important. Like, if we want to make our complete census, if we want to get complete information regarding the birth rate, death rate, mortality rate of women, morbidity rate, incidence rate, prevalence rate, it is very important that we should go and visit the area, and we should go and interact with the public. We as a public health experts go and sit with the people who actually are part of that particular community. Now, another thing which usually public health expert faced, according to me, is the same thing. We can say that lack of resources and lack of skilled person. See, we have many public health experts. We have n number of public health experts, but few people knows how to collect the data. Few people knows how to interact with the public. Only few people knows how to approach to the public. Only few people knows how to approach to the society. So it is very important that we should have a skilled person in the public health sector. We should have a responsible person in the public health sector who actually knows how to approach the society. And I think the government has to support to the public health experts with respective to resources and all. Because if you don't have any resource, if you don't have anything to show to the community, nobody will come up with the issues, nobody will come up with the things, so everything will be messed up. So I think it is very important that government support, not only government, non-government organization has to support to the public health experts, so that we can able to deal with lot of things. Now, one more example I would like to share with you. Like, we have faced a lot of challenges related to COVID-19. Everybody knows that. Even after COVID-19 also, still we are facing a lot of issues. We are not able to diagnose the things properly, like whether it is like symptoms are same for dengue, for typhoid, for COVID-19. But we are not able to diagnose the thing, whether the person is having COVID, whether the person is dengue positive, or whether his person is typhoid positive. Why? Because people, they don't have trust on us. They don't have trust on the health centers. They don't have trust on the services which are provided by the doctors and the health centers, right? So it is these are the biggest challenges which actually the public health experts faces nowadays.
Okay.
Yeah,
thanks a lot. Once again, important question you've addressed, and mentioning technical words, morbidity and mortality and incident rates, and also at the same time I figure out that level of mendacity which is existing and prevailing right in the society becomes very difficult, a kind of failure and handicap for government also to sort of pitch in and sort of cause it in a more better and comprehensive and constructive way, any policies and programs of public health when it comes like specifically in this area. Would like to move on to my third question. Again, one question says, share your perspective on the attitude of public health experts when conducting research in public health, including the use of false and unreliable quantitative and qualitative body of data.
See, in community health, this field or public health field, we talk about the comprehensive health services. So when we talk about the comprehensive health services, that means that includes everything, starting from physical aspect, mental aspect, spiritual aspect, everything should be a part of your comprehensive health services when you're dealing with the people in society or in community. Now, we as a public health experts, we can conduct a lot of researches in the public health field, starting from qualitative researches, or we can talk about the quantitative researches, or we can talk about the mixed methodologies. So we can go for a lot of researches in public health sector. But yes, sometimes this is my observations, or we can say that this is my experience, but I feel that sometimes we are not able to collect the data which is related to gender issues, which might be related to like those areas like which those areas which you are not able to collect the data. For example, like one of my batch, BSc graduation batch, I told them to collect the data related to this this women violence only, violence against women in your areas. So they went many houses. They went around 50 houses to collect the data related to the particular topic. Then after 15 days, 20 days, they report back to me and they told me, ma'am, we have collected the data, and they come up with the data and with analysis part also. So I was surprised, like everybody has shared their opinions, everyone has shared their views, everyone has shared their insights related to that particular topic. Every woman who is residing in that area. But how it can be possible? Because still we are in 2024, this is tech era, technology is there, but somehow I can feel that you can't ask questions from the community related to these issues. And okay, 1%, 2% population can be there. They can come up with the views, they can share their ideas related to that thing. But many people, 98% women, they never share their ideas related to this particular topic, even though they are facing violence in their home only. They will never come up with those things. They will never share anything with you, right? So how can you collect the data related to that? So it was very surprising for me. And the shock part is that only I was shocked when I see that, when I saw like the analysis, the statistician has also done analysis of that data, that fake data. So I directly told to that group, like, this is fake data and no one will give you, this, we can say that answer to your questions to that particular topics. This data, your data is fake. Yes, I have seen many people, they come up with the fake data, they come up with the fake analysis part also when we talk about the researches in public health. But I can say that you can go for a lot of researches in the public health instead of focusing on gender issues. Gender, we have to focus on gender issues. But whenever you're going to frame the questions for collecting the data in research, you have to modify your things in that. Like instead of asking the question directly to the society, asking the question directly to the concerned person, modify your thing, manipulation can be done so that you can able to collect the data related to that particular issues in the society, which basically faces by the women's or girls in the society. Now, one more thing I would like to share with you. My one more group is there. I told them to collect the data related to the rape cases in that particular area, that too in the adolescent age group. So they went, then after 1 month, they came up with the data, surprising, came up with the data. So they said, ma'am, these are the cases happening in that area. These are the things which actually done with the females and all. These are the issues which actually, actually is faced by the, public health experts also in that particular area. So I was also surprised at that point of time. Like, why you are sharing the fake data with me? So this is my experience. I can say that people are conducting a lot of researches, but few people are there. Few, I can say that 1%, 2 people are still there. They are collecting. They are not able to collect the data. They are just sharing the fake data, and they are sharing the same fake data with the statisticians also, and they are conducting the researches. But as a manipulate the thing, somehow I manipulate my questions and I collect the data on that. So I think the attitude of public health experts should be like that only. It is very important to collect the data. So manipulate your ways, manipulate your questions and collect the data instead of sharing the fake data with the statisticians and with the public health experts. Do that.
Thanks a lot for your deep insight, and it's again important to learn that there are people who are even experts in practicing public health and coming up with fake and false data. It may be quantitative and qualitative, which actually is a fator and handicap to authentic research body, and it becomes a problem for policy formulations and for the research activities and other programs to be implemented. Of course, it's a handicap and a deep insight by you. Thanks a lot once again. I would like to move on to my fourth question, which is again a very, very important question. It says, explain the concept of digitization in the public health sector and whether you believe it is a necessity of the hour.
Yes, digitalization is a necessity of an hour. Why we can say that? Because we are in tech era. We are in 2024. So I think digitalization plays very, very important role in public health sector. How we can say that? See, now the government, they have given tabs to the ANMs also. Like whatever the data you want to collect the data, you can enter everything in your tabs. So every ANM, the auxiliary nurse, midwife, whosoever is a part of the health centers, they have tabs in their hands. So they download the apps in the tabs and they directly fill the data in that particular tabs. So the digitalization plays very important role in public health. Second thing, there is electronic health records. So the importance of electronic health record is each and every data, each and every information is a part of that particular app, is a part of that particular record. So that if suppose a person requires some, we can say guidance from super specialty hospitals or some other doctors, we can directly share the data with that particular person so that we can provide the treatment then and there only. We have telemedicine also, we have telenursing also. So that is digitalization only. So there is no need to go anywhere. If you feel sick, if you feel you need some medical support, you need some nursing support, immediately you can contact to the concerned person, online only, video calling only, as we are interacting with each other. So that point of time, you can directly get the treatment. You can get treatment. You can prevent yourself from various diseases. So digitalization plays very important role. So everything is there on electronic media. Everything is available on system only, in the data only. So we just go and search the patient's name, we go and search the patient's ID number. You enter the patient's name, enter the patient's ID. You get each and every information starting from OPD treatment till the patient comes for the follow-up.
Again, thanks a lot. Your comments, digitization is really important and it's need of the hour, and how it can expand the very possibilities in the area of public health, and it's really a blessing and a boon for us. And of course, it's important, and your perspectives are definitely a learning for our audience. Would like to move on to my wrap-up question, fifth question, and final question. Important question once again. Explore the potential connection between Indian public health and Indian sociology. A very, very important question for us also, and for our audience also, ma'am. Do you see any commonalities and correlations between the two?
Yes. Sociology is what? Sociology is society only. Like you have to deal with the society, whether it is joint family, whether it is a nuclear family. You're going to deal with the genders, you're going to deal with the religion, you're going to deal with the culture. So that is sociology only, right? And what is public health? Public health means you're going and providing services to those society. Public health has no sense. And public health, and without public health, sociology has no sense. So they are related with each other. So you have society, you have this community, then only you have public health concept. So both are very, very, very important, and both are related with each other, according to me.
Yeah. Okay. So thanks a lot, Dr. Anu Gabaji, joining us from Amity University, Gurgaon. It was really a blessing and certainly a deep understanding shared by you on various topics of public health outreach activities, programs, challenges faced by government, professional opinion, serious and real challenges about, and perspectives on research attitudes or in experts, and digitization is one of the concepts that we've talked about, and kind of correlation interconnection between sociology and public health. As you're already familiar, RESO is a platform sort of exploring sociological perspectives in different domains. It may be public health, human rights, human trafficking, environmental challenges, climatological
Yes,
challenges,
yes,
disaster management, different topics we try to figure out from a sociological perspective. We sort of look sociology in everything. That is the reason we just
yes,
want to make
yes,
a database. It may be academic database and research database, and sort of record database in research and academics on at the platform of RESO. That is the reason we get in touch with different experts and sort of people from different domains, and look for their opinion, their perspectives, and sort of share with our audience, so that we can cause benefit and sort of disseminate the information at larger section of the society. So that is the reason. Once again, thanks a lot joining RESO platform, ma'am.